Hello viewer, ujambo. Welcome to this GTN Nursing Services where I, Grace the nurse, talks about mother and child health care. I hope you have had time to see the other video clips whereby detailed information is given as health talk for mothers who visit the clinic, because they say that every time a mother visits a clinic, she ought to be given a health talk. So in this case, we have put them online for mothers to be able to learn at their own pace. So today we are talking about family planning. Our usual reference book is this book, the MOH 216, the one that mothers are given in the clinic for the first time when they visit. Soon they realized that they are pregnant. We are on page 22 of 44. And the page 22 of 44 from the booklet, it is talking about family planning. So our topic of today is on family planning. This is because from this booklet, when you visit the clinic for family planning services, you are supposed to be given this book. This book is supposed to be used for the record purposes, whereby the date is put, the method is indicated, your weight is taken, the blood pressure is noted, and a return date is given. So we have date, family planning method, the weight, the blood pressure, and the remarks. The place for the remarks is for the return date for follow-up purposes. Okay, so let's now go ahead with our today's learning session, whereby by the end of this learning session, the viewer should be able to understand the aims of family planning program in Kenya. You are supposed to understand the benefits of having a family planning method, and there are some things you ought to note when joining a family planning program. How many things? 3. The learning objectives of today include aims of family planning program in Kenya, benefits of having a family planning method, and the things to note when joining a family planning program. Welcome. So for the aims of the family planning program in Kenya, number 1, it is to delay a pregnancy until such a time one wishes to do so. That is, the aim for the family planning program in Kenya, number 1, is to make the user to delay a pregnancy until such a time one is ready or wishes to do so, or ready to carry a pregnancy. Number 2, it is to promote healthy timings and the spacing of pregnancies due to low fertility. When you start a family planning method, you are lowering your fertility. So by that, you are able to promote healthy timings and the spacing of pregnancies. And number 3, the aim of family planning methods in a family planning program in Kenya is to reduce the risks of birth challenges. Mothers, when they carry pregnancies, 50-50, normal or challenge. By using a family planning method, you are reducing the risks of birth challenges. What are these challenges associated with births? It is low birth weight, that is having a baby whose weight is lower than expected, which usually the cutoff is 2.5 kg. Any baby born with kilos less than 2.5, that baby is labeled low birth weight. Number 2, preterm births. Babies can be born when their due date is not reached. These babies are called preterm babies. And then another challenge associated with the pregnancies or births is child or maternal deaths. So when one practices usage of family planning method, you reduce the risk of having a birth challenge, like having a low birth weight baby, a preterm baby, or having a child death or a maternal death. Okay, let's go to the learning objective number 2, benefits of having a family planning method. One of the benefits that has been indicated is that it keeps away unwanted or undesired pregnancies. Yes, using a family planning method keeps away unwanted or undesired or unplanned pregnancy, thus giving a woman time to engage in self-development. Yes, when one uses a family planning method, you keep away unwanted or unplanned or undesired pregnancy, giving you time for self-development. Number 2, it reduces the childbearing roles. When you use a family planning method, you are able to keep away unwanted pregnancy or undesired pregnancy. And then number 2, you are able to reduce the child-rearing roles, because when you have a baby, there are roles to accompany the baby. So when you delay away a pregnancy or you keep away a pregnancy, you reduce these roles. And number 3, it increases household savings and investments, which result from reduced spending on basic needs as food items. When you use a family planning method, you increase household savings and investments, which result from reduced spending on basic needs such as foods items. Those are the benefits of using a family planning method. Now, let's go to learning objective number 3, whereby we are supposed to see things to note when joining a family planning program. What are these things to note? Number 1, things to note. From the Kenya Policy Guidelines on Family Planning, print of 2018, things to note are according to the Kenya Policy Guidelines on Family Planning, print of 2018. And it states that everyone has a right to access, to choose, and to benefit from a wide range of family planning methods. That is from the Family Planning Program of Kenya, print of 2018 policy guidelines. It states that everyone has a right to access, to choose, and to benefit from a wide range of family planning methods. Number 2, family planning methods are highly effective in delaying a pregnancy when they are used correctly. Yes, and number 3, medical eligibility criteria is used by the service provider before provision of a family planning method. Okay, I hope it is clear the 3 learning objectives of today, whereby we were learning aims of family planning program in Kenya, benefits of having a family planning method, and things to note when joining a family planning program. Next time, we are going to see how a pregnancy comes about. Before we go to the methods, how does a pregnancy comes about? Remember to subscribe, to share, and thumb up if the information here is giving you information that you require. Thank you.